I start off with the first case. I think this has been on the screen for a while. Here's a patient. She's 60 years old and she complains of pain in the cheek, And you look at the CT scans, and you should be able to see the signs leading you to what you want to ask in the history. If you know what to ask in the history, you've got the diagnosis. So who would volunteer what to ask in the history? Yes, yes, thank you. Actually, it's a history of trauma. This patient had facial injury. And I put this up to support Professor Wu, John Wu, who said earlier on that when you have maxillary mucoceles, it's usually iatrogenic or due to trauma. And in this case, you can see the trauma. The trauma is that her eye is gone. This is a glass eye. It looks like Terminator 3, right? It's a glass eye. And you can see that there's elastic sheet here, where she previously had an infraorbital, she had an orbital injury there. And this is a elastic sheet, and this must have closed off her sinus ostia. And then she's developed a maxillary sinus mucocele. Yeah? Okay. Now let me go to my other case.
Are you going to tell us what you did?
Oh, we decompressed the mucocele from the nose, from the side of the nose, in the middle meatus. Just opening it up, yes, that's right. And that relieved the symptoms.
And she has no further?
So far, no further problems. This is an 85-year-old lady who presented with a grand mal fit for the first time, and the radiologist reported that she had a space-occupying lesion compressing her anterior cerebrum, causing this problem. Since there was a neurology, fits, so the first thing I did was an MRI, and here was a space-occupying lesion here on the scans. Yeah? And of course, when the ENT surgeon gets involved, then we get a CT scan. Yeah? And the CT scan shows a lesion here. It's a bony rim here, and here. On the axial cuts, a normal frontal sinus on that side. There you see the mass here. There's a bony rim around it. Yeah? It's a bony rim. Sagittal view. Again, you see this shell. Actually, the best thing to look at it with would be actually a plain X-ray, where you can see a bit of a ball-shaped space-occupying lesion here. Yeah? So we approach this problem. How would we approach this problem here? And what do you think this space-occupying lesion was?
Apart from the seizure, was there anything relevant in her previous history?
Nothing else. First time, 85-year-old lady. She has had no nasal symptoms of any kind.
Does that just communicate with the other slides? I mean, I can see an area there which
Yeah.
I think it may well be, but when you follow that sequential cuts, when you went all the way down, they follow all the cuts.
No,
Any
we
communication between that residual frontal sinus and the...
no, we didn't think there was a communication.
No communication?
No.
If there's no communication between this bony wall cyst and that frontal sinus,
Yes.
you've got to think about where it's coming from.
Mm-hmm.
Is it a supraorbital ethmoid, which coming up behind the frontal sinus,
Okay.
which has formed a mucocele,
Okay.
or is it not related to the sinuses at all?
Mm-hmm. Mm-hmm. Or could it be a type 4 Kuhn cell?
No way.
We believe that there could be type 4 Kuhn cells, so we were not so skeptical. So we approached it as for a frontal mucocele. And we opened up the frontal sinus from endoscopically. We couldn't reach, of course, this mass. And we made a brow incision, opened up this mass. It was a mucocele actually. And then we put a stent to connect the frontal sinus, connect this mucocele to the frontal sinus. Well, here it is. And this is the patient about 3 years later. So this is an endoscope, a flexible scope, and they can see that it's still lighted up and it's remained patent. It could be that for skeptic like PJ that we missed seeing a communication.
I would think that there'd have to be a communication between the two if you're calling that a additional cell.
Mm-hmm.
Either that or it's a supraorbital ethmoid cell.
Okay. Okay, these are my two cases.